The government is funding 2 safe drug supply sites to fight Toronto's ongoing opioid problem, a crisis that has worsened during this pandemic. In July, a record-breaking 27 people died of suspected overdoses, deaths that advocates say could have been prevented.
To put it in context, significantly more than the number of people in our city who died of COVID.
As COVID-19 was spreading, the number of suspected opioid overdose-related deaths quickly rose. Toronto Public Health says since March, there's been an 85% increase over last year.
We're fundamentally dealing with tainted drugs. It's an opioid poisoning crisis as much as it's an overdose crisis.
Between May and the end of July, receiving 651 calls, of which 58 cases were fatal. And those are just the numbers provided by paramedics.
There has been reports since April that we're seeing more than 200 deaths per month, the highest since the tracking began in 2017.
The federal government announcing today $582,000 will go to Parkdale Queen West Community Health Centre to run a year-long overdose prevention centre. The second Safer Supply program will be run by the Downtown East Collaborative Safe Opioid Supply Program, made up of South Riverdale and Regent Park Community Health Centres, along with Street Health, offering health and social services, including, quote, reliable pharmaceutical opioids instead of the tainted drugs often purchased elsewhere, as well as access to treatment,
which is more difficult to access during the pandemic. This site will offer supervised consumption, harm reduction services, education, and 24/7 on-call services for shelter residents.
This is being called an extension of the harm reduction interventions that focus on decriminalization, a life-saving measure and evidence-based approach that destigmatizes people who use drugs.
We know that the war against drugs has a differential impact on Black and Indigenous bodies and brown bodies who are substance users. All of this makes it difficult for people who use drugs to get compassionate care with dignity.
It isn't just Toronto dealing with the spike in deaths. Councillor Cressy noting that over 15,000 Canadians have died from suspected overdoses over the last 4 years alone, the majority of them young people.
This is good news, but we are late in our response, and that many of these deaths, these thousands of deaths, could have been prevented by faster action.
Today's announcement, part of the government's $1.5 million funding towards harm reduction here in Toronto. Advocates adding that although this is a welcome step, they're calling for more funding and support towards overdose prevention programs across the city. At the Regent Park Community Health Centre in Toronto, I'm Faiza Amin for City News.